Which nerve innervates this muscle? Gabby here from bootcamp.com, and in this dissection, we're looking at the posterior aspect of the thigh as well as the gluteal region. So here's going to be the gluteal region, so this area will be superior, and as we travel more inferiorly or more distally along the aspects of the lower limb, we're going to be able to find the posterior aspects of the thigh. Now, within the posterior compartment of the thigh, we have three muscles that are responsible for either extending the hip joint or for flexing the knee joint. Now, those three muscles include the biceps femoris, the semitendinosus, and the semimembranosus. And that's the order in which the muscles run from lateral to medial. So we said this was superior, this was inferior. This is going to be lateral, and this is going to be medial. So starting laterally, we're going to be able to find the biceps femoris, and biceps meaning two, so it has two heads. So similar to the biceps brachii in the arm, we have a biceps femoris in the thigh. So the biceps femoris is going to have two heads. So the two heads of the biceps femoris muscle include the long head. So the long head of the biceps femoris is going to be a lot longer, meaning it's going to originate more proximally along the lower limb on the aspects of the ischial tuberosity, versus the short head, which is found over here. Here's that muscle belly. The short head is going to go and originate along the aspects of the femur. So it's going to originate more distally along the lower limb, and both of these heads will eventually converge together to form one tendon that will go ahead and insert on the head of the fibula. So as we move more medial, we're going to be able to find the semitendinosus. And the semitendinosus muscle gets its name because it has a very long tendon. So if we see this muscle belly and we continue to follow it more distally, you're going to see this very long tendon right over here that goes to insert on the medial aspects of the tibia. Medial to the semitendinosus, we're going to find the semimembranosus. So think medial, so M, think M for membranosus. So the semimembranosus is going to be a lot more membranous, and the muscle belly itself is going to be a lot thicker compared to that semitendinosus. So sometimes in a cadaveric dissection, it can be difficult to see how the semimembranosus is actually more medial because the muscle belly itself is a lot larger. So its actual muscle may look like the semitendinosus is more medial. But nonetheless, the best way to differentiate between these muscles is to look for the tendon, right? So semitendinosus is going to have this very long tendon that is going to insert and contribute to the pes anserinus, so the three muscles that form this little goose foot, and they attach along aspects of the tibia. So that includes the semitendinosus, the sartorius, and the gracilis. So look for that tendon to differentiate between the two. So that being said, all of these muscles in the posterior compartment of the thigh are innervated by branches of the sciatic nerve. Now, the sciatic nerve is one of our largest nerves, and we could actually see how large it is in this dissection. So this guy over here is the sciatic nerve that's actually emerging from the greater sciatic foramen, eventually piercing underneath that piriformis muscle. So the sciatic nerve is going to pierce underneath or inferior to the piriformis and travel distally along the thigh. And as it enters into the thigh, it's going to provide branches to go and innervate those muscles. We eventually see the sciatic nerve bifurcating or splitting into two branches, one going towards the lateral side and one going towards the medial side. Now, the branch that's going towards the lateral side is going to be the common fibular nerve. Remember, the fibula is lateral, so the common fibular nerve is also going to be lateral. And then we have the tibial nerve, which will be traveling more medial and will eventually continue down along the posterior compartment of the leg. Now, remember that the sciatic nerve is actually just the combination of these nerves. So sometimes you may hear that the muscles in the posterior thigh are innervated by the sciatic nerve, but you may also hear specifics on whether or not these muscles are innervated by the tibial portion of the sciatic nerve or the common fibular portion of the sciatic nerve. And these muscles can actually differ on their innervation if we were to specify which branch or which division it's innervated by. So all of the muscles of the posterior compartment, except for the short head of the biceps femoris, are innervated by the tibial branch of the sciatic nerve. And the way that I like to remember this is having a look at the location and the proximity of the short head of the biceps femoris and that common fibular nerve. They essentially run adjacent to each other. So because they run adjacent, the common fibular nerve is going to provide branches to go and innervate that short head of the biceps femoris. Now, the long head of the biceps femoris, the semitendinosus muscle, and the semimembranosus muscle are all innervated by the tibial branch or the tibial division of the sciatic nerve. So in terms of our question here is which nerve innervates the semimembranosus muscle, the answer should be tibial nerve.